I have a couple of guests in studio with us. They join us on Wednesday mornings. Not the two of them together all the time, but periodically they both come into the studio. Dr. Jonathan Tripp and, of course, physician assistant Russell Singleton from Tripp Family Medicine right here in Twin Falls. First of all, welcome.
Good morning.
The two of you are here. This has got to be something serious.
It is. It's way serious. In fact, so serious I'm going to have Russell mainly tell you about it.
First of all, we need to tell people a little bit about Tripp Family Medicine when they are looking to actually find you, contact you, because a lot of people are hearing you on the air, and I'm sure they sometimes miss the announcement of exactly where you are, how they could get in touch with you, and you are actually seeing new patients at this point.
Absolutely.
And they can call you?
They can call us at our office. That's 208-933-4400. You can reach us on Facebook at Tripp Family Medicine and also on our website at trippfamilymedicine.com. But yeah, definitely taking new patients, encouraging the whole family, you know, the kids, mom, even dad sometimes we take. So
yeah,
it's all good.
Usually the toughest member of the family.
Yep.
The toughest to convince to come see a doctor.
Yeah, no, even I'm a tough one to get to go see the doctor. So I understand that.
And Russell, what do you have for us today?
Well, today I'd like to talk about something about which I'm pretty passionate, and that's the overuse of antibiotics. This is something that has been in the media lately. If you've been watching the headlines, you might have seen something about McDonald's or the Tyson company now pledging to remove or at least lessen antibiotic use in their products. And that is something I wanted to talk about today because in medicine, the overuse of antibiotics is actually contributing towards a lot of scary things, antibiotic resistance being the main thing.
I was going to say, I heard from a friend who was in nursing some years ago that if you just spill some of these things on a patch on your hand, that area of your hand, for instance, it becomes a very dangerous spot for the rest of your life. I
don't know. I like to believe that what I learned in microbiology is it takes a pretty good sample of a bad bacteria to really take hold. We have a great immune system, especially if you have intact skin. Now there are exceptions. We have people that run around every day that have decreased immune systems. Diabetics are among those. You know, especially anybody that's got a compromised system like with cystic fibrosis or asthma or especially HIV. Those are all people that are very much more susceptible to whatever's around, whether it's respiratory or, you know, skin contact. And so we have a couple of examples, but this is kind of a broad topic, but the main focus is antibiotics don't cure everything, and yet we've grown up with several generations now believing that, you know, if I'm sick, I need an antibiotic, and the truth is it's hard part as a physician and practitioner to say, you know, I may not be able to cure this. And, you know, the patient's response is often, so why did I come to your office? Because if you can't cure it, so a lot of it is for the advice to say, well, what do we do? How can we best support this? And sometimes it's traditional medicine, and other times we have some alternative or anything from herbal to colloidal silver. There's all kinds of things that people use with good effect to help with common colds and other viral illnesses that an antibiotic won't help with.
Right, and that's the thing. You know, there's no impact whatsoever from the antibiotic on any virus, right?
Yeah, exactly. I think that's another very important distinction to make. Antibiotics are things that by the very definition of the word are against living organisms. Viruses are not living. They're infectious materials, infectious proteins that have the ability to take over the cellular machinery and reproduce, but they're not living. So giving something that's anti-living, antibiotic, from the definition of the word doesn't make sense. But I think it's important when a patient comes in, it's important to distinguish what is going on. And to be quite honest, we can't always tell what is causing their symptoms when they come in. If a patient comes in with a sore throat, for example, a viral sore throat looks and acts much like a strep throat would, which is caused by a bacteria. Now, that doesn't mean that we're shooting in the dark and that it's impossible to make a treatment decision. It just means that it's not as easy as some patients think. And when they come in thinking, oh, I need an antibiotic, if I don't get an antibiotic, I'm not going to get better, I don't think they consider what is actually causing their symptoms and how an antibiotic may actually do them harm. And sometimes I spend a lot of time explaining how an antibiotic would be a bad thing. There are side effects of the medication, diarrhea, abnormal heart rhythms. But then one of the bigger things that we're concerned about is creating resistant infections. The more you use antibiotics, the less likely they are to help you when you really need them.
We need to take a break, and we had a caller who's looking to get in touch with us, and we didn't have a lot of time before the break, so what I'm going to ask is, caller, if you're patient, give us a shout on the other side in about 3 minutes or so. In the meantime, Tripp Family Medicine, it's called Better Health with Tripp Family Medicine this morning on Top Story on Newsradio 1310 KLIX and Newsradio1310.com. PA Russell Singleton in studio with us, as well as Dr. Jonathan Tripp. Both here. They can answer your questions in just a few minutes. I want to mention we have a caller who's been on hold with us and been very patient. We'll get to our caller in just a second. I just want to mention very quickly we're coming up on 8:44:57 at our studios. Quick spike in our temperature already, on the way to about 80 today. We have a couple of guests in studio because we call this Better Health with Tripp Family Medicine. Dr. Jonathan Tripp and physician assistant Russell Singleton joining us in studio, and we do this every Wednesday between 8:30 and 9 o'clock. Right here on Top Story on Newsradio 1310 KLIX with Bill Colley. And our caller is, I believe, still patiently waiting. Good morning. You're on the air.
Yeah, good morning, mate. I guess I've got a question here for a couple of the good doctors. Let's say that we're in a veterinary situation. We've got a cow or a hog, but obviously in a respiratory infection. Indeed, it could be viral. But most of us are going to say, well, gosh, we'll give him the antibiotic. We don't snap out of it, and we know it probably is viral. We should go ahead and do the microbiology, as the physician said. The problem is, if you're wrong, and it is not viral, you've lost 3 days and now you've got an epizootic. And I'm curious, is that similar? It's got to be similar in people, although it'd be a bit easier to do the microbiology. I've never been to a physician yet that says, well, you've got an upper respiratory infection. I believe it's bacterial. Here's a Z-Pack. Yeah, I should go ahead and do the microbiology and find out indeed what the bug is. But they're not going to do it because probably it's faster and it's cheaper, and most of the time they're right. I'd like him to speak to that if he could. Thank you.
Yeah, a good question.
Yeah, I think you brought up some really great points, and that problem does happen in the clinic. So personally, what I would do is first look at the time frame. I'm looking at the symptoms. They are very, very similar between viral and bacterial diseases, but there are a few differences. For example, if an individual has been suffering with something for less than a week, statistically, it's much more likely that it's viral, and so I'm much more likely to be a little bit more conservative at the onset. But when you get to a week or more, or if the patient is struggling significantly, if their symptoms are such, you're absolutely right. I am going to order some microbiology tests. I'm going to look at doing a rapid strep test, a throat culture. Sometimes we'll do things like a chest x-ray or a spirometry to get a better idea as to what's going on. But I think there is a little bit of room for judgment when you're not sure, when the risks are high. I think you do err on the side of caution and you treat. In fact, Dr. Tripp's going to tell us a little bit about some cases that we've had this last week that kind of set the scene for treating or for erring on the side of caution and for treating in order to avoid some pretty significant consequences.
I want to give you 2 scenarios, and thank you for the call. One is a lady who is otherwise very healthy, physically fit, has no known significant medical problems, and came down with a simple urinary tract infection and has not had frequent antibiotic exposure throughout her life. And so, as far as I can tell, to no blame of her own, she has contracted a bacterial urinary tract infection that had resistance to almost every antibiotic we know except for one class, which is only available by IV antibiotics, and even then was only partially susceptible to the antibiotics. So this is a lady who was hospitalized twice in about a 1-month period for what otherwise would have been a simple urinary tract infection that then later became a true kidney infection and threatened her life over a resistant bacteria that she wasn't responsible for. She just came into contact with it and had the bad luck or misfortune of contracting what had been created by the overuse of antibiotics by others. And so that's one reason for the general populace to actually care about, do we overuse antibiotics or not? And then let me give you almost the opposite scenario. Young lady I saw yesterday, 8-year-old little girl that has almost never had antibiotics in her whole life, came in with what we thought was going to be an ear infection. As I examined her, she had symptoms that fit with a typical upper respiratory cold type symptoms, but she also had swollen tonsils with pus on the tonsils. The ears were fine, and because of her lack of antibiotics in the past and the scenario of how she went from a fever for several days and then into congestion for several days and then was getting worse, I chose to go ahead and treat her with an antibiotic even without doing a rapid strep test or any other throat culture analysis, knowing that this still could be viral, but because it's not following the typical viral pattern and because of her lack of exposure to antibiotics, I had a higher willingness to treat her individually. So academically, the correct choice, according to academics, would have been to do a throat culture, wait 3 days while she perhaps might have continued to get worse before I treated her with antibiotics. But because she had so little exposure, I went ahead and treated her. And now I also wanted to bring up that we treat strep throat not because of sore throats. In fact, I'm going to let Russell address that.
Well, hold on for a moment, Russell, if you could. We have another caller, I believe, with us. And you're on the air right now at 8:49 on Newsradio 1310, KLIX, newsradio1310.com. And, of course, the program is called Better Health.
Yeah, I was just wondering, my wife is pregnant, and she has been having a urinary tract infection. And they're not allowed to take antibiotics, are they?
Actually, that's a great question. There are antibiotics that we know are safe in pregnancy and that will not harm the fetus. And so she absolutely does need antibiotics. If she has a urinary tract infection, any primary care provider would know how to choose a safe antibiotic in pregnancy, but her obstetrician should also be aware of that, and he would very likely prescribe her antibiotics. That is a great question, because if the infection worsens, that could put the pregnancy at risk.
And you had a follow-up, of course, to what the doctor was talking about.
Well, I think it's great to illustrate how we treat people on a case-by-case basis. We don't try and fit everyone into this mold and practice this cookbook-type medicine. We look at the patient individually and treat them individually. For example, I saw a patient recently who is a smoker, has very severe COPD, and I couldn't really tell if when they came in with chest congestion, shortness of breath, and a worsened cough, if they were actually suffering just an exacerbation of their COPD, or if it was somehow infectious. And I think the guidelines are a little bit more lenient there. You treat them because the consequences of letting a bacterial exacerbation go are high enough or scary enough to where we don't take that risk. We go ahead and we treat.
We have a caller with us. This portion of the program, of course, Better Health with Tripp Family Medicine. It's 8:51 and 60 now at our. It's going to get really hot today by the sounds of things. Our caller, you're on the air with the doctor and the physician assistant.
Hi, good morning. He had an incident in the ER last night. Won't tell you where, but it was interesting. The doc had a child with a high fever, and the doc didn't want to do a rapid strep. Said that even if it was strep throat, it wasn't a big deal, and antibiotics don't do much for strep anyway. And of course, I kind of force them to do rapid strep. Anyway, just your thoughts. I mean, should you treat strep or not?
Absolutely.
Yeah, I hate to second guess the ER doc because a lot of my career has been as an ER physician, and the truth is you only have one shot, whereas in family medicine, I literally could bring that child back tomorrow and say, let's look again. So I don't want to crucify them. On the other hand, did they end up doing the rapid strep and was it positive?
I guess he's not with us any longer.
Okay, if it wasn't positive, then I think the topic or the idea of saying, let's wait, go follow up with your family physician would be an excellent choice for avoiding unnecessary antibiotics. If that rapid strep test was positive, then the treatment for strep is very straightforward. Things like amoxicillin, sometimes azithromycin, or what's called a Z-Pak, depending on the age of the person. But treating strep really is not about treating the fever or the throat pain. It is really about protecting against further problems that the strep bacteria can cause with the heart valves or with kidney troubles, even to the point of kidney failure. Or in the old days, you would hear about rheumatic fever. And rheumatic fever is still alive and well, but it's much less prominent because of antibiotics. But it actually causes heart valves to be kind of beaten up and eventually congestive heart failure. So no, if strep is there, it needs to be treated within about the first week to 10 days, even if the throat is getting better. So yeah, I would disagree with that, but not knowing all the facts, I really don't want to crucify the physician or practitioner that saw you last night.
One thing you could say, and listening this morning, is that sometimes you have to err on the side of caution, and it seems you do that because if you're not sure and somebody is sick and you're worried about them, as you mentioned, getting worse, you'll try a lot of different things while you're waiting to see what the actual trouble is.
Yeah, and symptomatic treatment is really what we often do. We try to do the least harm. That is exactly the creed of the practitioners. The Hippocratic Oath is the first do no harm. But in the case of, I'll give an example, another tonsillitis, mononucleosis will often have very big tonsils, lots of pus, very sore throat, high fevers, and the person is just miserable, but an antibiotic won't take care of it because it's a viral illness. So what do? Well, if they get to the point where they're really having difficulty taking in fluids, or especially difficulty with swallowing or breathing, we'll go ahead and not only use things like ibuprofen or other antihistamines to try to dry things up, but we'll use steroids because the steroids will suppress swelling no matter what the cause. They don't cure. In fact, they actually depress the immune system a little bit, so there's a catch with the use. But when it comes to protecting the airway is most important, and so there are other things we can do, even though most patients will walk in and say, hey, I got big bad strep throat, and it turns out it's not strep throat.
And I would add to that too that doctors get sick, PAs get sick, and we want good treatment too. We want to feel better. And so when a patient comes in and we feel pretty comfortable that this is a viral illness, you're going to be okay in the long run, but here are some things that I use. Here are some things that Dr. Tripp uses. Try them out. I know they work. I know they're helpful. I really think this is best for you. It's safest. And I don't want to put you through the dangers of unnecessary antibiotic use. This is what I would do.
In fact, at our office, we have a handout that actually comes from my house, and that is, our typical cold or upper respiratory infection. It's exactly the combination of things that I use on my own children, on my wife, on myself. I just finished a 3-week-long upper respiratory infection that, most patients would have said, shouldn't you have been on an antibiotic? And the answer is, I know better, and the antibiotic would have done me no good, but it was a long time. That 3 weeks is a long time to wait to get better.
I wanted to point out, we're getting near the end of the program today, but for people who would like to get in touch with you, web, Facebook, and telephone number, three ways really, right?
Yeah, all the above. TrippFamilyMedicine.com, that's Tripp with 2 P's. We're on Facebook, or call us at 933-4400. We're accepting new patients. We pride ourselves on being able to take a lot of same-day appointments as well.
I want to point out, too, that for people looking to get there, you've been pointing out all along, it's it's not far away. It's not far from Pole Line Road. It's not off the main highway, but there's a little bit of for people who might be coming in from out of town. You take patients from Nevada, for instance.
Absolutely.
Fillmore Street, fairly simple to get to, but sometimes you need more than a GPS. Maybe they could call ahead too and get some directions, right?
Yeah, the telephone number is 208-933-4400. And if you come and shop in the north end of town, because you're from out of town, if you can find the post office, we're right across the street from the post office. And the same day or next day appointments, we reserve for people that are sick or hurt. And that's our whole motto, or one of our operating modes is, if you're hurt or sick, we try to get you in quick. And I did copyright that one.
All right. Well, I want to thank you both for coming by today. We'll do this all over again next week. Thank our callers, too, as well, for chiming in.
Next week, we're going to talk about silent killers. So everything that you think, oh, that couldn't be a problem, we're going to talk about next week.
Yeah, you may look fine on the outside, but on the inside, sometimes there's a problem. We've got more coming up. Rebecca Milsoyko joining us from the Twin Falls City Council in just a few minutes, following news from Fox at 9 o'clock this morning.